Okay, so get this. Just imagine a city where more than half the patients in their hospitals are actually from other states.
What?
Yeah, that's Delhi's healthcare reality. It's like this
Mm-hmm.
crazy mix of, world-class care and just this constant pressure on the system. And today we are diving deep, all three tiers. I mean, we're talking the famous AIIMS.
Right.
And we're going to talk about those Malhala clinics, which you might have heard about. There are some surprising things. I think you're going to learn a thing or two along the way. So buckle up.
Yeah, Delhi's like a fascinating case study, right?
Yeah.
You have this mix of like cutting edge facilities like AIIMS, which let me tell you sees a massive number of patients, and it's really famous, like globally known for its contributions to medical research, right alongside like just your everyday vital secondary hospitals like Deen Dayal Upadhyay or Hedgewar Arogya Sansan.
Yeah.
And then you also have this really ambitious attempt to deliver like basic healthcare just right in the neighborhoods with the Malhala clinics.
Okay, so Malhala clinics, I'm already intrigued, right? Like, it's like they're trying to reinvent primary care, like from the ground up.
Yeah.
But before we jump into that, let's back up half a step, right? So we've got these three tiers, like you mentioned, right?
Right.
Tertiary, secondary, primary care.
Yeah.
But then on top of that, you have the Delhi government also pushing for free treatment in all the government hospitals. And then they've got these financial aid programs like the Delhi Arogya Kosh.
Mhm.
I mean, it feels like they're juggling like a lot of different approaches all at the same time.
They really are. And I think this really kind of highlights a crucial point. The Delhi government is like deeply committed to providing this model of free healthcare. So, aiming to provide tests, medicines, even surgery referrals, all completely free of charge in their hospitals.
Wow.
But as you can imagine, that comes with a big price tag. Balancing that level of quality care with this financial burden is a real struggle. It's a constant struggle, especially when you just think about Delhi's population and how it's growing all the time.
I mean, yeah, that makes total sense, right? So where does something like the Delhi Arogya Kosh, like how does that fit into this whole picture? I know it's designed to help with costs, right?
Yeah.
But how is it different from, say, the national Ayushman Bharat scheme?
That is a great question. And that's actually where it gets really interesting. So the Delhi Arogya Kosh is specifically for those Delhi residents that need these really critical, often very expensive surgeries or treatments. And the unique part, the truly unique part, is that it covers some specific procedures that Ayushman Bharat doesn't, which, kind of makes it a crucial safety net for a lot of people.
So it's like this extra layer of support, like very targeted at, those people who are experiencing like really difficult cases.
Yeah.
But then, it's not just about like dealing with the current demand, right? Because at the same time, the Delhi government is also like on this huge building spree, like new hospitals are popping up, medical colleges, like all over the place. So I have to ask, are they trying to like get ahead of the curve here?
They are, absolutely. Expanding that infrastructure and just training more and more doctors is essential. It's absolutely essential to keep pace with the growing need for healthcare services. And frankly, it's also a way to try to tackle those chronic doctor shortages that we keep hearing about, which, as you know, can really have a serious impact on the quality of care patients receive.
Absolutely. And let's be real for a sec. Like no conversation about Delhi, right, is complete without mentioning like the air quality, right? Yeah. It's not just a minor inconvenience. I mean, this is a public health emergency.
Oh, yeah.
So how much are these government pollution initiatives actually, like, are they making a dent in this issue?
Well, they're definitely trying. I can tell you that.
Yeah.
I mean, you see the odd even car scheme. You see those smog towers around the city. So there's definitely a push to try to improve the air quality. But the reality is Delhi is fighting an uphill battle.
Yeah.
The air pollution is directly linked to a huge rise in respiratory illnesses, which, of course, puts even more strain on the healthcare system.
It's like they're trying to patch up cracks in a dam. That's just constantly spraying new leaks, right? But speaking of cracks, let's dive into like some of these systemic issues that are really putting pressure on Delhi's healthcare, right? And we already know that over 50% of the patients, like in Delhi hospitals, they're not even from Delhi.
Right.
They're from outside the state. So why are so many people coming to Delhi for treatment? Like, what's the draw?
Well, it's not hard to see why. Delhi has some of India's most advanced healthcare facilities, and the cost, even when it's not free, is often lower, significantly lower than in other states.
Okay.
So people are traveling, sometimes for their lives, basically, seeking treatment that they just might not have access to back home.
So you have this huge influx of patients, right? Which just obviously adds to the strain. But what are some of the other like major challenges that this system is facing?
Well, as we mentioned, there's the ongoing issue of shortages. And we're not just talking about doctors here, but nurses, technicians, that whole support system. When you have medical professionals who are overworked, it inevitably impacts the quality of care that patients receive. And this isn't just limited to the big hospitals either.
Yeah, I was going to say, I've actually read like a bunch of reports about how even the Mahal clinics, which sounded so promising on paper, they're also facing these staffing and resource challenges. It's almost like it's a great idea in theory, but when you put it into practice, it's really struggling to find its footing.
You're absolutely right. There have been significant operational hurdles, let's say, with the Mahal clinics.
Yeah.
Inconsistency with medicine supplies, just the difficulty of attracting and keeping doctors in these neighborhood settings. These are very real problems.
Yeah. It almost feels like the ambition of the program kind of outpaced its like implementation.
Right.
And on top of that, it's not just about having like enough doctors in hospitals, right? It seems like location is actually a major factor as well.
Yeah, you've hit on a crucial point. The distribution of healthcare facilities in Delhi it's incredibly uneven.
Oh, yeah.
South and central Delhi are typically well served, but the northern and eastern parts of the city often lack access to that same quality of care.
It's almost like you could draw a line down the map of Delhi and the healthcare realities on either side are just drastically different. And I would imagine this probably affects the most vulnerable populations disproportionately, like the migrant population, right, who often live in those underserved areas.
That's exactly right.
Yeah.
Access to quality healthcare shouldn't be determined by your zip code or your socioeconomic status. And this brings us to, I think, another significant challenge, these environmental and lifestyle factors that are quietly driving up the demand for healthcare.
So we touched on air pollution, but what are some of the other like health trends that are really putting pressure on this system?
Well, alongside those respiratory illnesses, we're seeing a concerning rise in what we call lifestyle diseases, obesity, diabetes, hypertension.
Yeah.
These are often linked to things like sedentary lifestyles, unhealthy diets, and just the constant stress of city life.
Yeah. So it's not just about treating the illnesses themselves, right? It's about addressing these underlying causes, which are very much intertwined with how we live and the environment we live in. And this actually makes me think about the role of the private sector, right? Because Delhi has some of the best private hospitals in the entire country. But I have to ask, how much are they actually helping to alleviate the pressure on that public system?
They definitely play a role, but here's a fact that might surprise you. Despite having the highest density of private hospitals and clinics in India,
wow,
a substantial portion of Delhi's population just can't afford private healthcare.
Yeah.
The costs are just too high. So that leaves them reliant on that already overstretched public system.
It's like this weird paradox, right? You have this abundance of high-quality care, but then right alongside these massive affordability barriers.
Yeah. So can the private sector really be part of the solution? I mean, can these two worlds, public and private, can they somehow be bridged in a way that benefits everyone? And that's what we'll be exploring when we come back for part 2 of our deep dive into Delhi's healthcare. We left off talking about this disconnect, right, between Delhi's thriving private healthcare sector and then the fact that so many people just can't afford it.
Right.
So how do we bridge that gap? Is there some way to bring these two worlds together, like public and private, and create a system that's more equitable and more effective?
I mean, that's the million-dollar question, right? And there's no easy answer. But one idea that's often talked about is expanding the role of what we call public-private partnerships, or PPPs.
Okay, PPPs. I'll admit, I hear that term all the time, but I'm not always sure what it means in practice, especially for something as complex as healthcare, right? So can you break it down for us a little? Yeah, absolutely. I mean, in the simplest terms, a PPP is basically a collaboration between the government and private companies to deliver a service, right? And in healthcare, one way this could work is through strengthening the existing referral system.
Okay, you mean like how the government already refers some patients to private hospitals for certain procedures and covers the cost, right? Could we scale that up somehow?
Exactly. It could potentially take some of that pressure off of the overcrowded government hospitals, right?
Yeah.
And give patients faster access to that specialized care that they might not be able to get easily in the public sector.
But wouldn't that just shift the problem over to the private hospitals, though? I mean, wouldn't they become even more overwhelmed?
That's a really valid concern, and that's why any PDP model would have to be like really carefully designed,
Yeah.
right? And implemented. You need clear guidelines, transparent processes, and like a really robust monitoring system to make sure that you're ensuring quality of care and also that you're preventing any misuse of funds.
Right.
You know, it's not just as simple as redirecting patients. It requires a much more structured framework.
That makes a lot of sense. Are there other PPP models like that we could consider? What about the national Ayushman Bharat scheme? Like, could that be expanded in Delhi to kind of help bridge this gap?
It's definitely a possibility. As you know, Ayushman Bharat is a health insurance scheme, right? And it's designed to give financial protection to families that are more vulnerable.
Yeah.
Currently, though, its implementation in Delhi it's kind of limited. It's limited both in the coverage it offers and just the number of residents that even qualify.
So the idea would be to broaden its reach within Delhi, right?
Yeah.
Like maybe cover more
Yeah,
residents, a wider range of treatments, that kind of thing.
Precisely. I mean, it could provide, some really needed financial support to people who can't afford private health care, but they also don't fall under, those existing government-free treatment programs. It's really about creating a safety net for those who would otherwise, fall through the cracks.
Yeah, I mean, that makes sense. Okay, so we've talked about like referrals and maybe expanding insurance coverage, right? Another idea I hear a lot is encouraging corporate investment in healthcare, like, get the big companies to build hospitals, especially in those underserved areas we talked about. But I have to ask, like, how realistic is that? Is there really like an incentive for businesses to prioritize healthcare when it often has like lower profit margins than other sectors?
Yeah, you've hit on a key challenge. It's not enough to just encourage investment. You have to make it attractive.
Right.
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 So we have to create the right incentives, maybe things like tax breaks, subsidies, something to make healthcare a more appealing investment for the private sector.
And I can imagine there's also just like the whole red tape thing.
Oh, yeah.
I mean, India's bureaucracy is legendary, right? And I can only imagine the hoops you'd have to jump through to set up a hospital, even with government support.
Absolutely. I mean, streamlining that whole regulatory process is just crucial.
Yeah.
If you want to encourage that private investment, you have to make it easier to, set up and actually operate healthcare facilities,
Yeah.
especially in those areas that are in desperate need.
So it's about creating an environment that's both financially and just logistically like conducive to that private investment. But let's not forget about like the role of technology in all this.
Right.
I'm particularly interested in the potential of telemedicine.
Yeah.
We talked about this unequal distribution of healthcare facilities in Delhi, right? So could telemedicine offer a way to like overcome those physical barriers, right?
Yeah.
And connect people to the care they need no matter where they live?
It absolutely can. I mean, telemedicine has the power to be a game changer, especially in a city like Delhi, which is so sprawling and congested. Imagine, being able to consult with a doctor, get a diagnosis, even receive some treatment advice all from your own home without having to deal with like the traffic or taking time off work.
Right. I mean, it sounds incredibly convenient, but what about the quality of care? Like, can you really get the same level of attention and expertise like through a screen?
That's a common concern. And that's why telemedicine has to be like implemented in a smart way, right?
Yeah.
It's not a replacement, right?
Right. Yeah.
For certain conditions like, follow-up appointments or managing chronic illnesses, telemedicine can be incredibly effective.
Okay.
And it can also be invaluable, like connecting patients in, more remote areas to specialists that might not be available locally.
So it's not about like replacing that in-person care completely, but more like expanding access, right? And offering people more options, especially those who might face barriers to more traditional healthcare.
Right. It's about bringing healthcare to the people instead of expecting people to always travel to healthcare.
That's a great way to put it. It's about using technology to bridge those gaps, right?
Yeah.
To make it more accessible and ultimately to make healthcare more patient-centered.
Exactly.
This has been incredibly insightful, but I want to kind of shift gears a little bit and look ahead to the future.
Okay.
What are some of the key things we should be watching for in Delhi's healthcare landscape? Like, what needs to happen to really move the needle and create a system that truly works for everyone?
Well, as we've discussed, infrastructure development it's crucial.
Yeah.
We need more hospitals, clinics, diagnostic centers, but not just randomly placed.
Right.
We need to target those underserved areas in East and North Delhi strategically to ensure that there's equitable access to care.
So it's about creating like a more balanced like healthcare map of the city.
Yeah, exactly.
So to speak.
Yeah.
Right. And what about those Mahalla clinics? I mean, we've talked about Mahalla Clinics 2.0, this like revamped, upgraded version.
Right.
What would that actually look like in practice?
I mean, imagine a network of Mahalla clinics that are just seamlessly integrated with the whole healthcare system.
Okay.
Each clinic would have electronic health records.
Copy.
So doctors could access a patient's complete medical history,
Right.
No matter where they were treated before.
Okay, that's huge, right? No more like carrying around stacks of paper files.
Exactly.
Or trying to remember every detail of your medical past.
Exactly. And these clinics could be staffed with, a mix of general practitioners and specialists.
Okay.
So they could offer a much broader range of services right there at the community level.
So you're not just treating like basic ailments, right? You're potentially catching like more serious issues much earlier on, right there in the neighborhood.
Right. And with telemedicine capabilities, right? These clinics could connect patients with specialists anywhere in the city or even the country.
Right.
You know? So it's further expanding that reach and impact.
It's almost like creating these little mini healthcare hubs, right?
Yeah.
Bringing that specialized care closer to the people who need it most. But we can't talk about like Delhi's future without addressing, the elephant in the room, air pollution. It feels like this like unavoidable obstacle on the path to a healthier city.
You're absolutely right. It's not just an environmental problem. It is a fundamental public health crisis that demands action.
Yeah.
We need stricter emission standards for vehicles and industries, better enforcement of those standards, and we need major investment in public transportation.
And I think it's important to acknowledge that it's not just about government policies, right? It also comes down to the choices that individuals make, like opting for public transport, choosing to cycle or walk, or even just like being more mindful of our energy consumption, those kind of things.
Yeah. You're absolutely right. It's a collective effort.
Right.
We all have a responsibility to create a healthier environment, and that really does start with the choices that we make every single day.
Absolutely. Speaking of choices, let's talk about technology, specifically AI.
Okay.
We touched on its potential, but I want to go a little deeper.
Yeah.
How could AI really revolutionize healthcare in Delhi?
Well, imagine a world where AI algorithms can actually analyze your medical history, your genetic data, and lifestyle factors.
Okay.
To predict your risk of developing certain diseases.
So it's like personalized predictive healthcare.
Yeah.
But instead of like vague pronouncements, you get like actionable insights.
Exactly. And based on those insights, AI-powered tools could recommend, preventative measures, lifestyle changes, or even, early interventions to mitigate those risks.
Okay.
So we're talking about shifting from like reactive care to proactive care, addressing health issues before they even arise.
That's incredible. It's like having a virtual health advisor, right? Like guiding you towards a healthier future. But what about the actual treatment side of things? How could AI change the way healthcare is actually delivered?
Well, I mean, the possibilities are really vast.
Yeah.
Imagine AI-assisted robotic surgery, where the precision and accuracy is enhanced beyond human capabilities.
Right.
Or AI-powered drug discovery platforms that can identify potential treatments for new diseases really, really quickly.
I mean, it all sounds so futuristic, but you're saying this is actually within reach.
It is. And let's not forget about the potential to personalize treatment plans. Imagine receiving medications and therapies that are specifically tailored to your genetic makeup and lifestyle.
Okay.
Maximizing their effectiveness.
Yeah.
And minimizing, side effects.
It's about moving away from that one-size-fits-all approach to healthcare that's truly tailored to the individual. I mean, it's really exciting, but let's be realistic for a second. All these incredible advancements, they require a lot of investment. So where's that funding going to come from?
That's a valid concern, and that's where those public-private partnerships that we talked about earlier become even more important.
Yeah.
We need to create an environment that encourages both domestic and foreign investment in healthcare innovation.
So we're talking about like incentivizing businesses to get involved, streamlining regulations, maybe even creating like special economic zones that are dedicated to healthcare research and development.
Exactly. And let's not forget about the role of philanthropy.
Right.
Yeah. We have some really generous individuals and organizations in India that are passionate about improving healthcare.
Right. Imagine if some of that philanthropic funding was directed towards, building state-of-the-art hospitals or funding cutting-edge research or training the next generation of healthcare professionals.
Yeah, you're talking. It's about creating a collaborative ecosystem where the government, the private sector, and civil society are all working together towards that common goal.
And speaking of a collaborative ecosystem, we have to kind of circle back to a fundamental piece of this puzzle that we haven't fully explored yet, and that's insurance.
Yes, you're right. We touched on it briefly when we talked about Ayushman Bharat, but I think it deserves a deeper look.
Yeah. Why is insurance so crucial in the context of Delhi's healthcare?
Well, you see, Delhi's current model relies very heavily on government-funded programs and free treatment in public hospitals. But as we've discussed, this puts a huge strain on the system, and it's just not financially sustainable in the long run, especially with the growing population and the rising healthcare costs.
So it's not just about like providing the care, right? It's about making sure that the system itself can survive, can be financially viable, and continue to serve people.
Exactly. Expanding health insurance coverage could really help to alleviate some of that pressure. It would allow people to access private health care without, facing financial ruin. And it would reduce their reliance on the already overburdened public system.
So it's about creating a more balanced and sustainable healthcare ecosystem, right?
Yeah.
Not just relying on the government to shoulder the entire burden, but empowering people to kind of take control of their own healthcare decisions.
Precisely. I mean, a robust and inclusive insurance system combined with those effective public-private partnerships and smart investments in technology and infrastructure. I mean, these are all essential ingredients in the recipe for a truly thriving healthcare system in Delhi.
It sounds like a really complex challenge, right? With lots of moving parts, but there's also like the sense of optimism, right? Like this feeling that real change is possible.
Absolutely. Yeah. Delhi is a city of incredible resilience and innovation. I mean, if any city can figure this out, providing quality, accessible healthcare for all its citizens, I think it's Delhi.
All right, listeners, we've covered a lot of ground here, but we're not done yet. In the final part of our deep dive, we're going to explore what it would actually take for Delhi to become a model for other Indian cities.
Right.
What are those big ideas, the game-changing policies and the innovative solutions that could really transform healthcare in this bustling metropolis? Stay tuned. Welcome back to the deep dive. We spent the last two parts, really kind of exploring this intricate web of Delhi's healthcare system, the good, the bad, the challenges, and some of those glimmers of hope. But now let's try to be visionaries for a second.
Okay.
Let's actually imagine what a truly successful model healthcare system could look like in Delhi.
I love that. We've kind of dissected all the issues, brainstormed some potential solutions. Now let's paint that picture of what an ideal future could look like.
Right. Imagine Delhi not just keeping up, but actually setting the standard for other Indian cities.
Yeah.
When it comes to providing good quality, accessible healthcare to such a massive and diverse population. So what would it take to get there?
It would take, I think, some bold thinking, a willingness to really challenge the status quo and embrace some of those truly innovative solutions that we've been talking about.
Okay, so hit me with those bold ideas.
Yeah.
Where do we even begin?
Well, we have to start with the foundation, right? Infrastructure. We talked about needing more hospitals, clinics, diagnostic centers, especially in East and North Delhi.
Right.
But it's not just about quantity. It's about strategic placement and quality as well.
So not just building to build, right, but really thinking about where these facilities will have the biggest impact.
Exactly. Yeah. We need to pinpoint those areas with the greatest needs and make sure that those new facilities are equipped with the latest technology, that they have skilled professionals, and that they're really designed with patient well-being at the forefront.
And what about those Mahalla clinics, right? We talked about Mahalla Clinics 2.0, this revamped, upgraded version. So what would that look like in reality?
Imagine a network of Mahalla clinics that are seamlessly integrated with the entire healthcare system.
Okay.
Each clinic has electronic health records,
Mm-hmm.
right? So doctors have access to a patient's complete medical history,
Right.
regardless of where they were treated before.
Okay, that's huge. So no more like lugging around those giant stacks of paper files.
Exactly.
Or trying to remember every little detail.
Exactly. And these clinics could be staffed with a mix of, GPs and specialists. So they could offer a wider range of services.
Right.
Just right there at the community level.
So you're not just treating those like basic ailments, right? You're potentially like catching those more serious problems way earlier, like right there in the neighborhood.
Yeah, absolutely. And with telemedicine, these clinics could connect patients with specialists, anywhere in the city or even the country, really.
Wow.
So you're further expanding that reach and impact.
It's obviously creating like these mini healthcare hubs, right?
Yeah.
Bringing that specialized care right, to the people who need it most. But we can't talk about Delhi's future, right, without addressing the air pollution problem. It feels like this like unavoidable hurdle on the path to a healthier city.
Absolutely. It's not just an environmental issue. It's a fundamental public health crisis.
Yeah.
And it requires us to take action. We need those stricter emission standards for vehicles and industries, better enforcement of those standards, and we need to really invest in public transportation.
And I think it's important to acknowledge, right, that it's not just about government policies.
Yeah.
It's also about, those individual choices we make, opting for public transport, cycling, walking, even just being mindful of our energy consumption.
You're right. Yeah, it's a collective effort.
Yeah.
We all have a responsibility to create a healthier environment, and that starts with, those everyday choices.
Absolutely. Speaking of choices, let's talk about technology, specifically AI.
Okay.
We talked about its potential, but I want to dive in a little deeper here.
Yeah.
How could AI revolutionize healthcare in Delhi?
Well, imagine a world where AI algorithms can analyze your medical history, your genetic data, lifestyle factors to predict your risk for certain diseases.
So it's like personalized predictive healthcare, right?
Yeah.
But instead of like these vague statements, you actually get actionable insights. Exactly. And based on those insights, AI-powered tools could recommend preventative measures, lifestyle changes, early interventions to try to mitigate those risks.
Okay.
So you're moving from reactive care to proactive care.
Right.
Addressing those health issues before they even come up.
That's incredible. Like having a virtual health advisor,
Yeah.
guiding you towards a healthier future. But what about the treatment side of things?
Right.
How could AI change the way healthcare is actually delivered?
The possibilities are really, really vast.
Yeah.
Imagine AI-assisted robotic surgery where the precision and accuracy is just enhanced beyond human capabilities. Or AI-powered drug discovery platforms that could identify potential treatments for emerging diseases incredibly quickly.
It sounds so futuristic, but you're saying that this is actually within reach.
It is. It really is. And let's not forget about the potential to personalize treatment plans. Imagine receiving medications and therapies that are tailored to your genetic makeup and your lifestyle.
So you're maximizing effectiveness and minimizing side effects.
So moving away from that one-size-fits-all approach
Right.
to healthcare that's actually tailored to each individual. I mean, it's incredibly exciting. But let's be real for a second. I mean, all these advancements require massive investments, right?
Yeah.
So where's that funding going to come from?
That's the million-dollar question. And that's where those public-private partnerships that we keep coming back to become even more important.
Right.
We need to create an environment that encourages both domestic and foreign investment in healthcare innovation.
So incentivizing businesses to get involved, streamlining those regulations, maybe even creating those special economic zones that are dedicated to healthcare research and development.
Exactly. And let's not forget the role of philanthropy.
Right? Yeah. Yeah.
We have some incredibly generous individuals and organizations in India that are so passionate about improving healthcare.
Right. Imagine if some of that philanthropic funding was directed towards building state-of-the-art hospitals or funding cutting-edge research or training that next generation of healthcare professionals.
Now you're talking.
Yeah.
It's about fostering that collaborative ecosystem where the government, the private sector, and civil society are all working together towards a common goal.
And that actually brings us back to to a key element that we've touched on throughout this whole deep dive, and that's insurance.
Yeah, absolutely. I mean, a robust and inclusive health insurance system is really the bedrock of any successful healthcare system.
Mm-hmm.
It protects individuals from financial hardship. It eases the burden on the public system, and it empowers people to access the care they need regardless of their income.
So we're talking about expanding that coverage, making the policies more affordable, maybe even exploring those innovative models like microinsurance or community-based health insurance schemes.
Exactly. It's about making sure that everyone has that safety net. Yeah. That financial protection when it comes to their health.
So we've painted this picture, right, of a future where Delhi has this thriving, accessible, technologically advanced, and financially sustainable healthcare system. I mean, it's inspiring, but I have to ask, like, what are the potential roadblocks? I mean, it can't all be smooth sailing, can it?
Of course not. I mean, transforming a system as complex as healthcare is never easy.
Right.
There will be, those bureaucratic hurdles, political roadblocks, and even resistance from those who, benefit from keeping things the way they are.
But despite all those challenges, you seem optimistic. So
Yeah.
why is that?
Because I believe in human ingenuity and the spirit of Delhi.
Yeah.
This city has a remarkable track record of overcoming adversity and finding creative solutions to complex problems. And when it comes to something as fundamental as healthcare, I have faith that we can create a better future.
Right. And that's what this whole deep dive has really been about, right? Like,
yeah.
Exploring the complexities, acknowledging the challenges, but ultimately, like, holding on to that belief that positive change is actually possible.
Absolutely. I mean, it's a future worth striving for.
Absolutely. Listeners, that brings our deep dive into Delhi's healthcare system to a close. We've covered a lot of ground, and we hope you've come away with a deeper understanding of this really intricate, ever-evolving system.
Yeah.
But more importantly, we hope we've sparked some curiosity.
Yeah.
A desire to learn more, and maybe even a belief that a healthier, more equitable future is actually within our grasp.
It really is. Because ultimately, it's up to all of us, citizens, policymakers, healthcare professionals, innovators, to work together to create a healthcare system that really does serve the needs of everyone.
Until next time, keep exploring, keep questioning, and keep believing in the power of collective action to create a healthier and more equitable world.